Welcome, everyone, to the first of what we hope will be many Institute for Exposomics panel discussions. Our goal is to connect our researchers with the communities that are impacted by and benefit from our research. Exposomics is a study of all the most relevant environmental factors that interact with your body throughout your lifespan, affecting your health and risk of disease. Exposomics is different from traditional environmental health because rather than studying one exposure at a time, which is slow and costs millions of dollars per exposure, we are measuring the complex mix of exposures as they interact with your genes and internal systems all at once and over time. Our goal is to understand how environmental exposures shape health and to translate that work into prevention and treatment of disease, now and in the future. We will not wait decades to bring innovations to bear on people's health because we know that we can have a tremendous impact in pregnancy and early life now. When you develop a serious disease, it is not because of something that happened yesterday, but more likely with something that happened in your early life that triggered it. We're going back in time to find those environmental exposures and learn how to best prevent them. Today, you'll hear from 4 of our talented exposomic scientists about different areas of our work. Dr. Manish Arora will talk about innovations we are making to go back in time to measure past exposures as early as when you were in utero. Dr. Keisha Carroll will talk about integrating exposomics into the care of children and the work she's doing related to asthma, stress, nutrition, and health disparities. Dr. Douglas Walker will discuss the innovations we are making to devise new methods of measuring the exposome and what we are learning. And Dr. Mayan Falcade will discuss her work on exposures related to climate, aging, and disease.
Thank you, everyone. My name is Manish Arora, and today I would like to discuss novel technologies that we have developed at the Institute to address major public health challenges. Next slide, please. So I'd like to start off with one major difference between the study of human genes and the study of the human environment, and that is that our genes are static. From the moment of conception, we can use any snapshot technology at any age and get a good handle on what our genes look like. However, our environment is constantly changing, even within a day. So this poses a big challenge that Dr. Wright also alluded to. How do we understand a constantly changing environment, especially when it is the past exposures that impact our current health? Next slide, please. So one of the technologies I'm going to share with you today is built around baby teeth, on which I work with Dr. Christine Austin. The idea behind this is very simple. Just like most of us have looked at growth rings in trees, and if we count back along those growth rings, we can uncover facts about the tree's growth in its past history. Similar growth rings exist in human teeth. And using this basic biology of teeth, along with lasers that we have developed and other instruments such as mass spectrometers, we can now characterize thousands of chemical exposures many years in the past, even going to fetal development, because baby teeth start developing in the 2nd trimester. Next slide, please. A similar technology was developed by Dr. Lauren Petrick, where she uses dry blood spots. In the US and in most other countries, whenever children are born, the heel of the foot is pricked and a drop of blood is placed on a paper card. This is known as a neonatal dry blood spot. Dr. Petrick can take a small portion of this dry blood spot and measure thousands of such signatures that were present soon after birth. And because, like the US government, most governments around the world store these cards for many years, there are government biorepositories that we are now working with to uncover exposures of individuals who are now experiencing different disease states. Next slide, please. So that was a quick look at some of the technologies we are developing going to go back in time. But how are we using this to impact children's health today? Most of you are aware that the prevalence of autism continues to increase. And just last week, the CDC released estimates that now it is more than 2% of children who are impacted by autism in the US. However, it is surprising that there is not a single FDA-approved biomarker for autism, and therefore children are missing out on diagnosis early in life when treatment is most useful. Next slide, please. Related to teeth and the dry blood spot technology, Over the past 6 years, we have developed a related technology that uses a single strand of human hair and maps along the growth rings in that hair to build a temporal profile of thousands of exposures and our biological response. We had worked with partners in Japan, Sweden, and US to take this technology and do one of the most in-depth studies of autism spectrum disorder ever conducted using this novel biomarker. I'm delighted to say that in recently, and we just announced it last week, taking all this data to the FDA, we were given the world first breakthrough designation by the FDA that allows us to aid in the diagnosis of autism from birth up to 21 years of age. This is the only technology that the FDA has ever given such a broad approval to. So now we are at the precipice of helping our patients with these novel technologies. Next slide, please. Before I conclude, I just want to briefly mention that it's not enough to develop technologies and then develop clinical tools. One of the missions of our institute is to convey to our communities how these technologies work. In that regard, I want to acknowledge Doctors Galvez and Evans, who are developing communication tools where such technologies can be explained to the communities in which we work. We also hold various symposia in addition to the webinars such as this one, and we've recently also published a book to convey in very general and accessible terms the deep theoretical framework that underlies all this technological innovation. With that, I'd like to thank you for your time, and I would like to hand over to the next speaker.
Hi, I am Dr. Keisha Carroll, and I am new to Mount Sinai. I am the chief of the Division of General Pediatrics, and I'm also faculty in pediatrics and environmental medicine and public health. Next slide. So as a pediatrician, we work to promote good health, and we conduct screenings, and we treat common conditions. But as an epidemiologist, I think a lot about groups or populations of individuals who have disease and in efforts to prevent or treat them. We think about the who, where, and the when. Who's really important. We ask about parents. We ask about the women's experience during pregnancy. And we also ask about characteristics of children, because we know that where people work, their level of education, their economic status is related to health and disease. In addition to where people live, you know, where they're born, where they live, whether it's their structure of or the crowding in their home, or the resources in their environment, or the places where their people in their family work, or where they play. These factors all influence health and disease. Next slide. And timing is really important, and I'm particularly interested in the effect that prenatal and early life exposures can have on childhood diseases. One disease I study is asthma, which is very common, affects about 10% of kids in the US. And in my research and others, we've noted that a number of exposures during a woman's life or pregnancy, such as stress or nutrition or environmental toxicants, can influence the developing lung and immune system and predispose to asthma, as well as these exposures during infancy and in early childhood, such as whether a child is breastfed or not, or if they're exposed to secondhand smoke. These are factors that can either potentially protect or put children at risk of developing asthma. Next slide, please. And so, although in the past, I've typically studied these single exposures, one incredible thing about Mount Sinai is the Institute for Exposomics Research, and the fact that they're leaders in the exposome, which is all the health-related environmental exposures throughout a lifetime. So instead of looking at individual exposures, we realize that there are many exposures that contribute to health. And also we're measuring the internal exposome, which can help us understand how these exposures work to either predispose or protect from disease. And I'm particularly interested in the internal fetal neonatal exposome, realizing that this is really the environment of the developing child and can predispose to disease. Next slide, please. And it's important to measure these many different exposures, and Mount Sinai is really at a leader at the cutting edge of many of these different techniques. As an epidemiologist, I often will use questionnaires as I'm trying to understand a person's smoking history or where they live. We often use pictures as we are trying to understand what type of medications a family may be taking, or what type of food they're eating. And we also measure biomarkers where we can actually measure different levels of chemicals or nutrients. And it's great being at such a collaborative place where there are people with complementary expertise who are measuring other environmental exposures, and they actually are developing the tools to analyze and really integrate them in ways that can relate to health and exposure. So that is that's the end of my presentation.
Great. Thank you, everyone. My name is Doug Walker. I'm an assistant professor in the Department of Environmental Medicine and Public Health, and a member of the Institute for Exposomics Research. Today, I'm going to briefly tell you about our research where we're trying to develop new methods that allow us to take biological samples like blood or urine and establish exposure profiles that allow us to see how your environment is related to disease outcomes. Next slide, please. Over the past 20 years or so, much of the focus in terms of developing new diagnostic tests has really emphasized the use of genetic biomarkers. Our current research and the research that's occurred over the past 20 years really suggests that only about 5 to 15% of diseases are due to our genetics alone. The other 85 to 95% are really derived from our environment, our lifestyle, and how that interacts with your genome. So if we're considering your genetics alone to understand your risk for certain diseases, we're really taking an unbalanced view of human health. Next slide, please. The focus on genetics has really led to a very large discrepancy in our ability to characterize the environment relative to its importance. There's been tremendous advances in techniques that allow you to understand your biology, such as being able to have your genotype characterized from 23andMe for a very, very low cost. But many of the methods that we're using to understand an individual's environment and exposure is really still using methods that have been applied for the past 50 years. And this pales in comparison of the exposures that we know that occur to humans on a regular basis. So because of this, there really is a critical need to start establishing methods and frameworks that allow us to better characterize an individual's exposome and understand how that's linked to disease outcomes. Next slide, please. The way that we approach this is through using very cutting edge and new analytical instruments to measure the internal exposome. And we do this through collecting different types of biological samples and looking to see what types of chemicals we can measure in them. This allows us to search for a very broad range of different types of exposures, ranging from environmental chemicals, commercial products, supplements and pharmaceuticals, as well as many different dietary chemicals. At the same time, because we're looking at internal measurements, we also have a number of different capabilities that allow us to look at metabolites that are naturally produced in our body. And this allows us to study the impact of different exposures, as well as how those could be related to certain disease processes. Next slide, please. Using the latest advances in instrumentation and data science, we are now approaching capabilities that allow us to routinely screen for tens of thousands, if not hundreds of thousands of chemical signals in a very small amount of blood, which is literally just larger than a drop. This has allowed us to not only exceed the analytical capabilities we need for precision medicine, but is now allowing us to approach a level of chemical measurement where we can start strategizing about how we can actually sequence the human exposome and try and understand the very broad range of exposures that we experience as humans. Next slide, please. And the ultimate goal of this is to really incorporate this into a framework that will enable us to do regular screening to measure your exposome over time. These measurements will eventually, or hopefully, be usable to forecast your risk for developing certain diseases, so we can identify and understand who is at risk of developing different outcomes, so we can either try and reduce these exposures or provide preventative measures for this disease. So with these methods, we're really hoping to incorporate our measurements into a framework that enables disease forecasting to better understand our health risks and identify new strategies for reducing these risks. Thank you for your time, and I was happy to have this opportunity to talk about our research methods and the approaches that we're using.
Hello, everyone. My name is Mayan Falcade. I'm an environmental epidemiologist. I was trained at Ben-Gurion University in Israel and the Harvard School of Public Health, and currently I'm an assistant professor here at Mount Sinai. I study how the environment affects cardiovascular diseases such as heart attacks or strokes, metabolic diseases such as diabetes, and mortality. And in this very brief introduction, I wanted to answer the question, could where you live predict your health? Next slide, please. So there are many exposures around your house or around your workplace that can potentially affect your health. If we take air pollution, for example, and air pollution is an umbrella that includes many ambient chemicals that can originate from traffic, from industry, heating, and many other sources. We know that air pollution exposure is associated with increased risk for many acute and chronic diseases, metabolic diseases, cardiovascular, respiratory, even psychiatric diseases, and mortality. We also know that exposure to extreme climate conditions, extreme heat and extreme cold weather, and also exposure to higher noise levels is associated with higher risk for cardiovascular disease and for mortality. On the other hand, living in a neighborhood that is more walkable or a greener neighborhood can have a beneficial effect. There are studies that show, for example, that people who live in greener neighborhoods are at lower risk for heart attacks. Now, in addition to these more commonly known exposures, there are many other exposures around your house that can potentially affect your health. Access to healthy food, for example, or the racial and socioeconomic composition of your environment, and many other exposures. Now, it all seems pretty simple and straightforward, right? If we take green space, for example, intuitively, it's a good thing. It encourages physical activity, provides you some, peace of mind and there are a lot of positive impacts. But we should remember that greenness is also associated with other exposures, chemical exposures, such as pesticides that are more, frequent in these areas. And as an example, in a study in Israel, we found that people who live in rural areas that are closest to cultivated fields were at higher risk for Parkinson's disease. So with exposomic research, we are able to account for these multiple concurrent exposures to measure how these exposure affect health outcomes while accounting for all the other exposures at once. Next slide, please. Just to show an example of the methodologies that we're using, here you can see two maps of exposures to air pollution and temperature in northeastern states of the US. In these models, we use satellite images and a lot more other variables that allow us to estimate these exposures at a very fine spatial and dipolar resolution. We then link these exposures to national health data sets that includes tens of millions of people. And we can use this big data to estimate how air pollution or temperature, for example, is associated with health. In a recent study, for example, we found that higher air pollution exposure is associated with an increased risk for diabetes, even for people who are exposed to lower air pollution levels. And that brings me to one of the main challenges that we face in our field, which is to convince the non-scientific community that these moderate exposures or sometimes smaller health effects that we are observing are meaningful and significant. And the truth is that from a public health perspective, these moderate exposures and often smaller health effects are meaningful and can have huge health impacts if we are considering, especially if we're considering this mixture of exposures that we're exposed to. So to answer the question in my presentation, the answer is yes. As I assume you've already figured it out. Your address can predict your health because it is associated with all the exposures that you're exposed to around the house. And it is important to remember that exposures that sometimes seem moderate can also have a huge effect on your health because these are exposures that you are exposed to on a daily basis throughout your life course. Thank you.
Oh, that was wonderful. And I want to thank all four of our speakers for those fantastic talks. We've received a number of questions in advance, and we've tried to collate them, and we'll go through that. These all came from the audience, but also you can have the opportunity now to send additional questions via the Q&A function, and we'll do our best to respond. But we got a large number, so we should probably just dive right in. And so we've divided them up by speaker, and we'll start with Dr. Carroll. So Keisha, this is actually a two-part question. What are you most concerned about in terms of environmental exposures for kids' health? And I'll ask the second part after you respond.
Sure. So I guess as a general pediatrician, I just want to say a lot, of what we do in terms of the anticipatory guidance that we give and counseling that we give families routinely is really informed by what we know in terms of trying to improve good health and decrease adverse exposures. And so there are a number of different environmental exposures. When we think about it in the context of not just sort of toxicants. So as we think about nutrition and for example, breastfeeding during infancy and shaping a healthy eating environment, nutritional environment that is protective in so many different ways regarding health, even if in terms of protecting from obesity sort of later in childhood and adulthood. Many of the routine vaccinations that we give, they protect children from viruses and bacteria that aren't as common, but we still see that we have emerging, viruses to deal with as well. And often factors such as environmental children are exposed to secondhand smoke. And there are many negative consequences and diseases associated with that as well. And I think many people are thinking about climate change and extreme temperatures and what that we see the immediate as well as probably the long-term effects from.
Thank you. It's very important to remember that the exposome is not just the things that are toxic, but the things that we can do in our lives that actually help our health and our child's health. The second part of the question is, what practical advice do you have for parents to reduce exposures and protect their kids?
Well, a lot of what I just talked about, foundational in terms of breastfeeding when you're young, routine vaccinations, keeping even though we are still in the midst of a pandemic and many people originally weren't seeking routine medical care. Now we are seeing kids come into the office, but I think that's so important to do because it's not just sort of medical condition, there are mental health conditions as well. So honestly, that would be key in terms of, partnership with your primary care providers, because we really work with families to go over a lot of different kind of exposures.
I think one of the strengths of Mount Sinai is, our primary care, particularly pediatric primary care, there actually is some training in environmental health. And so we do try to incorporate it into our primary care. So thank you. So the next question is for Mayan. How does your research show the health effects of climate change?
Yes, so I'm studying the consequences of climate change. As climate instability worsens, extreme environmental conditions are much more frequent and more severe. There are more droughts, heat waves, wildfires, air quality is worse, more hurricanes, and also in addition to these extreme events, global temperature is gradually rising. So my research is focused on specifically heat and air pollution and how these are associated with adverse health outcomes. As an example, in one of the studies, we found that heat exposure was associated with higher risk for hospital admissions due to strokes, heart attacks, and respiratory diseases. And these effects were much larger in people who lived in places where climate is less stable and temperature is more variable. So that shows the combined effect of both heat and climate instability, both are consequences of climate change.
Thank you. And the next question is for Dr. Aurora. Manish, can you talk about the role of time and how we understand health outcomes?
Thank you, Dr. Wright. So as I mentioned in my brief presentation, that a major difference between genomics and environmental health is that the environment is constantly changing. And humans accumulate a lifelong load of environmental influences, both the good and the bad. And that's what impacts our health today. So to be able to really understand how the environment impacts human health, we can't take a static view of the environment. We must take a dynamic view of the environment. And that's why we're developing so many technologies. For example, the one Dr. Mayan mentioned, where we are using satellites to go back in time and measure exposures to air pollution and temperature, not just today, but many years in the past. And that's how we must incorporate this dynamic view of the environment to fully understand how the environment impacts our health.
Thank you. The next question is for Dr. Walker. So Doug, how can you study real life complex exposures to mixtures that are experienced by living close to industrial sources like gas power plants?
Yes, thank you. That's an excellent question. There's a number of different approaches that we can take. What I focused on today was applying the methods that we've developed to characterize biological samples, where we look for exposure biomarkers that have been internalized. We're also applying this technology to other types of samplers. For example, we're working with these very low cost wristbands. I actually have one on right now that we can distribute to study participants or individuals who are interested in understanding their exposures. They wear them for a certain amount of time and send them back. And then we can apply our comprehensive exposome panels to those wristbands and get a sense of the exposures that are occurring. There would be a lot of opportunities to apply something like this and look at proximity to these sites or individuals who have lived there for extended times or have older homes in the area and see how their exposures differ than somebody who is further away. The advantage of our methods is that we don't necessarily have to know what we're looking for when we're analyzing our samples. We're trying to detect as many different exposures as we can. And then once we have the data, we prioritize what's important to our outcomes or our exposure scenarios.
Thank you. The next question, I'll take the next question, which is, can you explain the difference between environment and exposomics? So I think I'll answer by analogy. So I think people are familiar with the term genomics, which is measuring the 4 billion base pairs that each one of us has in our DNA versus genetics, which is studying one gene. So we have roughly 25,000 genes, and the field of genetics looks at one gene at a time. And there are a small number of diseases that are caused by one gene. Cystic fibrosis is a good example of that. Sickle cell anemia is another example of that. Phenylketonuria is another example. But that's actually a very small number of diseases that are only caused by one gene. So genomics was developed to look at all the genes and how all the genes come together to help understand disease. That's really an analogy for what the difference is between exposomics and environmental health. So instead of studying one environmental factor that might be related to a disease like air pollution and asthma, we're looking at all of them. We're looking at chemicals like phthalates or metals like lead and how they may also contribute to asthma. So we can look at all these different contributions at once so we can get a better understanding of how diseases come together and what age they present, and also what sort of treatments may be effective for them. So I think exposomics and the difference between exposomics and environmental health is really analogous to the difference between genetics and genomics. So the next question is for Dr. Arora. Autism prevalence was recently increased to 1 in 44 by the CDC over, I believe it was 1 in 60. So what environmental exposures have been linked to learning disabilities such as autism and ADHD?
So there's increasing evidence linking air pollution, some pesticides, some metal exposures as well that we have found. However, we must be careful in not making the same mistakes of the past and trying to assume that it would be a small number of chemical exposures that are driving this rise in autism prevalence. Autism is a truly complex condition. So in a manner, what you just said, that genomics sees diseases as complex and having multiple genetic alterations underpinning complex genetic diseases. In the same way, we must take this complex view when we study exposomics of the environment. So it's likely that there are multiple environmental exposures disturbing our biological response pathways, how our body responds to this. And we are seeing some early evidence that some of the inflammatory pathways are involved. Some of the pathways that regulate key essential elements like zinc are involved. And these are perturbed not by just one or two types of exposures, but by a broad range of exposures. So it's unlikely that it's just very few culprits at play here. It's probably most likely a complex mixture of exposures.
The next question is for Dr. Ishaq Sadeh. How can physicians and scientists contribute to evidence-based policymaking to protect the health of communities? New York City has laws that prohibit idling, but they are not fully enforced, for example.
So I think we can make an impact in two ways, really. One is through education. And for that reason, we always try to communicate our research findings to the general public in addition to the scientific community in terms of will be simple and easier to understand, even if you're not from the field. The other part is through driving policy change. Now, policy action involves a lot of politics and economic forces and a lot of conflicting interests. So you really need sound scientific evidence to drive policy change. In recent years, I'm working on providing evidence that air pollution exposure within levels that are now considered non-harmful by the EPA can still have health consequences. And just to give context, only recently the World Health Organization has released a new set of air quality guidelines with standards that are much lower than the standards that are currently here in the US. And these guidelines are based on review of scientific evidence of studies like the studies that we do here that show that these lower air pollution levels do have health consequences. So the good news is that we often succeed to drive policy change.
Thank you. So the next question is for Dr. Carroll. What are the resources at Mount Sinai that families can access who are concerned about environmental exposures in their homes?
So Mount Sinai has a number of different resources. As Dr. Wright said, the physicians who are going through training here actually get some education on environmental exposures or environmental health during their training. And we also have other resources. For example, there's the Environmental Pediatrics Program, which is a clinic which families can be referred to manage, common environmental health problems in children that such as high lead levels. There's also an environmental asthma clinic. Triggers and that are irritants and allergens are, very common causes of sort of asthma exacerbations or attacks, and it takes a lot of really detailed, personalized counseling to get good control of your asthma, because what a trigger for one person is not necessarily a trigger for another person. And so they really have the time and the expertise to help families manage their asthma. And those are just two of the resources that are here.
So the next question is for Dr. Walker. Can you describe technological advances you're most excited about to understand each individual's unique exposome profile?
Thank you. Another excellent question. One thing I've noticed over the past 10 years or so is that the instrumentation has improved tremendously. And in many ways, the mass spectrometers and other measurements we're doing in the lab now are incredibly powerful. The biggest challenges we face with our measurements is the data science component that allows us to pick out the important signals from background noise or other measurements that may not be as important to our outcome. So I think a lot of the advances that I've been most excited about is just to see how our ability to detect signals, characterize those signals, and also assess how mixtures of exposure lead to diseases has been what I'm most excited about. I'm a chemist. I love being in the lab and working with instruments, but we're at a point where we're generating more data and more rich data than we can handle with our current methods. So continuing to see the data scientists and exposome big data grow is something that I am most excited about and looking forward to in the future.
Thank you. So the next question is for both Mayan and Manish. Are there things I can do to counteract the health effects of harmful prenatal exposures, like certain foods or avoiding bad air quality? Maybe Mayan, do you want to answer first?
Sure. So the prenatal period is very important. Exposures in the prenatal period can shape how organ systems are formed. They can shape how genes are expressed. and have consequences in childhood and adulthood. But that doesn't mean that whatever you're exposed to as a fetus determines your health and there's nothing to do about it. In many diseases, heart attacks, for example, short-term exposures matter. In many of our studies, we see that exposure to air pollution on the same day of the event or a few days before the event is the exposure that triggered the heart attack. And if this person had avoided these high air pollution levels, this event might have been prevented. So there are things people can do to lower their risk for specific diseases, despite the exposure during the prenatal period.
Would you like to add?
I mean, thank you, Mayan. You answered pretty much all of it. All I would add is that the general advice that we receive during pregnancy and to focus on a healthy diet, not just during pregnancy but always, more reliance on organic food, controlling where the cleanliness of our food, water, and household exposures. All of these play a part, especially during pregnancy, but throughout our life. And the important things of these is that we can take charge of them. We are in charge of the food we eat and we buy, and the cleanliness of the water we drink in most cases. So I would just like to add that.
The next question is for Manish and Keisha. So neighborhoods that are majority Black and brown have higher levels of air pollution, heat islands, and other harmful exposures. How is Mount Sinai working to solve these problems and improve health outcomes in these communities? Manish, would you like to?
Sure. So we participate with collaborators around the country and around the world. I'm helping those researchers in Flint, where the children were exposed to toxic levels of lead due to contaminated water. Also working with colleagues in the southern part of Los Angeles, where there was an Exide battery plant, and because it was placed within very close proximity to housing, to suburban housing, mostly poor, under-resourced communities, there was again exposure to various toxic chemicals. We use the tooth biomarker to generate evidence, and this evidence becomes part of the big body of evidence that allows us to lobby for change, to lobby for compensation for the victims, and to make sure that there's a lasting change. However, the reality, and I've said this very often, is that racism is a public health crisis in this country, and we cannot say it in any softer terms. As environmental researchers, we must realize that race can no longer just be a covariate in our studies. It is the variable in many cases, because it drives such a large part of the health outcome, even in a country that is as wealthy as ours. I'll stop there. I'll let Dr. Carroll take over.
Keisha, your research is very heavily in health disparities and your expertise. Would you like to add?
Sure. I'd just like to say that I think there is more kind of, interest kind of in this area. And I think, really just, continuing to work to help people understand that just inequities in health, racial inequities in health, typically are not due to genetic factors. It's due to environmental factors, and just being very thoughtful and careful in the studies that we conduct in the patient populations that we recruit. Many of the studies that we've done, for example, looking at nutrition and asthma, oftentimes, although it was hard to believe, that there were some of the largest studies that had ever been done, because many times they were conducted in sort of larger European cohorts and that didn't have a lot of racial ethnic diversity. So I think that we should continue to be intentional in how we design our studies and engage our communities, and how we disseminate the information and use it to sort of educate people at all levels.
Thank you. So this is I'm going to take a couple of questions that just came in now. What is being done to educate pediatricians and OB-GYNs so patients are more educated? I'll try to take this one. With respect to pediatricians, Mount Sinai is unique, and as Dr. Carroll talked about, having the pediatric environmental health specialty unit, but also which specializes in environmental health more broadly and is publicly funded by ATSDR, which is part of the Centers for Disease Control. And we can actually distribute the contact information for our PACU. It's run by Dr. Maida Galvez here at Mount Sinai. And also we have a pediatric environmental health clinic where clinicians can refer patients. They specialize in patients with severe asthma, as Dr. Carroll also talked about, that will help patients. But in terms of education, this is, I think, a national issue. I think Mount Sinai does more than any other institution. Medical students and residents rotate through our pediatric environmental health specialty unit, as well as the environmental health clinic in Dr. Carroll's division. Leonora Mogilner actually also has a social pediatrics clinic that's run through Dr. Carroll's program. So we are doing more, I think, than most institutions, but I also would say that there's still a lot more to be done in terms of educating clinicians on the role that environment plays in their patients' health. Another question, how do you dissect contributions of various sources of exposure to health? Each of us is exposed to all types of social environmental factors at the same time. I'll try to, well, I'll start and I'll let any of the others jump in. The biggest challenge of Exposomics is that it is a big data science. So we are looking at hundreds of thousands, if not millions of data points, and we're trying to understand the role that they have. And there are methods for weeding out what is the noise from the signal. And they're similar to methods that genomics uses for weeding that out. But it is one of the biggest challenges of Exposomics, but it's also why Exposomics can move fast. So if you try to do a study on all of those 1 million exposures, that's 1 million studies. And it's also a lot more expensive to do 1 million studies than just a handful of studies to measure 1 million different environmental factors. So Exposomics will speed up the discovery of new knowledge, and it is borrowing some of the statistical methods from the other omic sciences such as genomics. So we do have the big data computational ability to do those analyses. And I think both Dr. Walker and Dr. Yuchek actually, from two different perspectives, actually do look at big data. And actually, I wonder if Mayan or Doug want to weigh in as well.
Yes, so I can say that a part of this is that we use state-of-the-art exposure models that allow us to estimate exposures, as I said, at a very fine spatial resolution, and account for these multiple exposures at once allows you to almost copy how these exposures behave in reality, because in reality, we're not exposed to just air pollutant, we're exposed to multiple things. And we use sophisticated statistical methods and methods that are referred to as causal methods that allow us to of course, with a degree of uncertainty, estimate how each of these exposures affect health while canceling out the effects of the other exposures.
And Doug, from your laboratory data science approach, any additional comments?
Yeah, I think in the past 30 to 50 years of environmental health and epidemiology, we've really, in a sense, been neglecting mixture effects, and that can extend to toxicology as well. And so that's where I see one of the biggest advantages of the exposome, and a lot of the data science methods that are being developed for it allow us to look at those mixture effects. So how can we incorporate the additive effects of different exposures? How do those contribute to your outcomes, and how can those identify individuals who may be at higher risk for developing diseases? I think we're continuing to see a lot of growth in those areas, not only in the methods that we apply in data science, but also in toxicology, testing and trying to impact the mechanisms behind exposure to multiple chemicals.
Thank you. The next question is for Dr. Carroll. The precautionary principle, or better safe than sorry principle, recommends that we should avoid certain exposures even when it's difficult to prove causality. Can you give examples in your work where this might apply?
Sure. I think there are a number of common environmental exposures that I'm sure families have heard about, chemicals like phthalates, it's probably not very exciting to people who are in environmental health epidemiologists, but that's something that we're starting to think and hear more about in general pediatrics. So phthalates and other chemicals can be added to plastics to make them last longer or make them more flexible. And so people can be exposed to them from a number of different ways, just from, food wrapping and through cosmetics and through toys. And so in our research team, we started to look at actually prenatal phthalate exposure by actually measuring levels in urine when women are pregnant and looking at associations with asthma in their children, for example, because they can have effects on the endocrine system, also with inflammation and kind of other measures. And, some of the results have been mixed, but I think in terms of just the body of evidence that's out there that, these chemicals are concerned, practicing, avoidance in terms of, and in terms of what you eat or how you eat, fresh fruit and vegetables, for example, will likely decrease your exposure, looking at, buying products that say, phthalate free or BPA free, which is another a chemical, and just practicing those types of behaviors is probably a good idea and recommended.
Yeah, I think, if there's no downside to avoiding exposure, I think it is the safer approach. Great, thank you. So next question for Dr. Aurora. What is the role of environment relative to genetics in cancer risk factors? And can you speak directly to breast cancer?
Cancer is not directly my area, so I'll stick to a very, very general answer. It varies by cancer. There are, of course, cancers that are very directly related to environmental and occupational exposures. In most conditions, we see that most complex conditions that the environment plays a bigger role. However, I would just like to point out that this is not some comparisons of genes versus environment. In fact, all disease, and I've heard you say this repeatedly, Dr. Wright, all diseases arise jointly from an interaction between genes and environment. So it's not to say that one is necessarily more important than the other, but over the several decades of research, the environmental component has largely been neglected. And now is the time, given that we are facing a climate crisis at a global level and within various specific communities in the United States and elsewhere, we have specific exposures, such as the Flint lead crisis. It is now time that the environment also is given the same importance as genetic exposures.
Can you speak directly to breast cancer?
I'm sorry, it's not my area, so I'm hesitant to provide information.
There are some researchers in our institute studying breast cancer, Susan Teitelbaum, so perhaps we could address that question to her. So one last question, we'll end with Dr. Walker. How can the work in exposomics in the US be applied to populations outside the US who have very different exposures and health concerns?
That's another excellent question. The best way to do that is really to establish collaborations that allow us to look at populations in different countries and different continents. I've received samples from all over the world from South America to North America, Europe. We've had a number of opportunities to work in Asian cohorts that were collected 10 to 15 years ago. There's been tremendous resources put into the Shanghai health studies and other cohorts where they've been collecting samples and tracking disease outcomes for years. And that's been a very precious resource. So it really comes down to collaborations and working with investigators who have access to those samples. But when I talk about this concept of sequencing the exposome, what we're really hoping to do is to have the systematic measures that allow us to detect a characteristic or reference exposome. And in order to do that, we're going to have to characterize exposomes from many, many different populations, from many different diseases, from many different geographical locations. And so our hope is to continue these collaborations and work with these different populations, but our data is generated in a structure that will allow us to synchronize across them and really think of ways where we can develop databases containing these different exposomes from different populations.
Thank you. We're getting close to 5 o'clock, so I think we'll stop there with questions. Before you log out, we have one final important request to leave you with. All of the innovation and impact we just discussed was made possible because of generous philanthropy that helped us recruit all the faculty you heard from today. All 4 were recruited because of the generosity of Mount Sinai's donors. Even though our work is just beginning, we've already made stunning discoveries that we are bringing to scale, but we need your continued help to do this comprehensively, to cover all disease and all aspects of development, to ensure that our scientists have the resources they need at their disposal to advance the visionary science of exposomics for all of us, our children and our children's children. So there's a special QR code or flow code that you see now on the screen. If you're interested, please point your smartphone camera to it. And it will take you to a web page where you can make a donation to support this urgent and important work. And thank you again for tuning in, and please stay safe. And thank you to all of our speakers, Dr. Carroll, Dr. Aurora, Dr. Yashade, and Dr. Walker for those fabulous talks and for your generous time to answer all the questions. So thank you very much. And we will try to answer some of the other questions that were in the chat and that we received as well through email and other sources. Thank you.